And let's toss it on over to the governor. Governor Mike DeWine listed in on his coronavirus update numbers for this Tuesday.
Got this in the mail a couple days ago. This is from my friend Rick Williams in Highland County. And in part, what he sent me a nice card. When everything started with the virus, Connie, his wife, and our daughter Lauren began making masks. The project grew to include Connie's mom, Fran. So 3 generations worked together. They have made close to 1,200 masks. When they reached $999 and $1,000, we all agreed that you should be the recipients. We know Fran has made several masks herself, but we thought she might enjoy one as a gift. So this is the mask. Again, made by, I guess Rick didn't make it, but Connie and Lauren and Fran. So Connie, Lauren, and Fran, thank you very much for doing that. I'm wearing a tie today from Bluffton University, Mennonite Liberal Arts University in Allen County, the Bluffton Beavers. So shout out to the Bluffton University. As we get back to work after Memorial Day weekend, we remembered, of course, this past weekend, those that gave their lives in defense of our freedom. As we start today, I'd like to take a moment to recognize those that are currently serving our country. We're very, very proud of them. We're going to start with a portion of the song It's America, performed by Camouflage, the country music performance team of the 338th Army Reserve Band. They are stationed in Whitehall and in Michigan, and they perform for Ohio and Michigan military members, veterans, and civilians through a variety of concerts, parades, sporting events, educational outreach events, and providing taps and honors for military funerals. This video was created using technology to continue mission training virtually. It recognizes what brings us together as Ohioans and as Americans. So let's take a listen.
It's a high school prom, it's a Springsteen song, it's a welcome home parade. It's a man on the moon and fireflies in June and kids selling lemonade. It's cities and farms, it's open arms, one nation under God. It's America. It's America.
Well, that was great. I want to talk this afternoon for a few moments, about testing in nursing homes. And as we are moving forward with more capacity to test, more tests available, not only through what the state is doing and what local health departments are doing, but also, of course, the private sector. And we would expect the private sector will continue to see them expand the availability of testing in the days and weeks ahead. As far as we are concerned, we have 2 big goals. One is to be able to focus on where there are hot spots, make sure we're able to move in with appropriate testing. The second big thing that we're doing is we are ramping up our local health department's capability as our detectives who, when someone tests positive, go out on a voluntary basis, talk with the individual, talk to the individual on the phone, and then determine who all they have been in contact with. And again, this is getting more aggressive on our behalf, going after the COVID-19. But today I want to talk about the first, and that is the hot spots. And I want to talk specifically about our nursing homes. As you know, a large number of our deaths in Ohio from COVID-19 have occurred in regard to nursing home patients. Nursing homes contain some of the most vulnerable members of our society. based, of course, on age, but also based on medical condition. So I have asked my team and challenged them to work with the Ohio National Guard, local health departments, local hospitals, to go after this problem. And so we are going to start this week, and we talked a little bit about this last week, but we're starting this week a new plan and a new effort, and it involves, I'm very proud to say, the Ohio National Guard and General Harris. We're standing up what we're calling congregate care unified response teams. These will consist of, I believe, 10 members. Will be up to 14 different teams. They will start testing in nursing homes this week. The National Guard will be doing the swabbing. Advanced work for this will be a combination of the local health department, our Medicaid and health departments at the state level will be involved as well. And so what they will do is to go into a nursing home, do the advanced work, and then that will be followed by the National Guard coming in and doing testing. Who is going to get tested? The goal will be to test all staff. So all staff will be tested. In regard to the residents, the testing of the residents will be based on assessment. Clinicians, as I said, the advanced team will go out. They will assess the situation at the nursing home. They will make a determination, maybe if there's a certain part of the nursing home that should be tested. In some cases, maybe all the nursing home should be tested. But this will be a decision that's based on clinically driven a strategy that targets those that have likely been exposed to COVID-19. We are going to start with the nursing homes that have had an experience of COVID-19, either currently ongoing or in the past several months. To kind of give you the big picture, there are 960 nursing homes in the state of Ohio. Approximately 200 of these have a COVID history. And so my only order to our team has been to deploy the resources we have as quickly as we have and to focus on the goal of saving the most lives that we can. And so this is clinically driven. This is medically driven. Clinicians are will be making these assessment decisions. The Guard will come in and then take the test appropriately based upon those instructions. So again, we will see that start this week. It will be an ongoing process. So we're not sure how many homes will be done every week. We will give you a report as we move forward, but this will be a continuation process that will go on for certainly for a number of weeks. And the targeting of what homes to go into, again, is based on what the clinicians think is the best and the most likely that they can save the most lives. So all homes, our goal is to have all nursing homes tested. We fully realize, and we always say this, Dr. Acton always says this, and I'm sure she'll have some comments after I get done, but testing, nothing magical about testing. It is a tool. It is a tool, and it's a snapshot in time. So when you go in and people are tested, it tells you who is testing positive now. And this, again, is particularly important. Although all nursing homes have been deploying for some time, since we started this, the best practices that we have talked about, where they're determining if a staff member, for example, is ill. But as we have learned, and it's driven home to us every day, there are a lot of people out there who are positive, are in all likelihood contagious, and yet they have no symptoms. And so that is why, one of the reasons that why this testing is in fact important. So this is a new phase. We begin it today, begin it this week, and we will be reporting back to you at least once a week exactly how that is going. Let me also announce also this week we will begin the testing of all residents and staff members of the state's developmental centers. This is an important effort to try to limit the spread of COVID-19 in these congregate care settings. Again, medically trained members of the Ohio National Guard will be at the state's 8 developmental centers this week to test residents and their staff. And so that is, again, something that will occur this week, and we believe should be, in all likelihood, completed this week. Dr. Acton.
Thank you, Governor. Good afternoon, everyone. We'll start, as always, with the numbers. And the confirmed cases right now in Ohio at 33,006 cases. And now in Ohio, we have over 2,002 deaths thus far. And that's an increase in the last 24 hours of 15. And the rest of our stats? Thanks, Eric. Our age range has changed slightly. We are now going from an infant under the age of 1 to 109 years of age. Still skewing mostly male. We know that we have tested over 337,000 individuals in Ohio at this point. The median age of cases is now 49 years of age. We are having about, of all our cases, 17% result in a hospitalization and 4% an ICU visit. We know that we are staying relatively stable in the numbers of COVID-related ICU visits. Next case. Great. Again, our trends, we are still looking over a 21-day period, and we are still seeing that we are very much in a plateau phase. We have a little bit of a down today in some of our numbers based on the 21-day average, but still very, very close. Next slide. Testing numbers continue to go up. We often see a little bit of a dip in the numbers over the weekend. Not all testing centers are operating every day, especially during a holiday weekend, but I suspect we'll see a pretty high uptick with the start of the week. And next. Our R0 numbers, again, we're looking for this reproductive number, this spread of one person to one person as our goal. We're still below that, although we do see a very slight uptick. This is something we'll be watching closely. As we've said in the past, a typical spread at the beginning of this disease was seen as one person being able to spread it to 2 to 3 people, as high as 5 people. In Ohio, since all the measures we took in our work together, we saw that get to 1 to 1 or below. A typical flu season is a 1 to 1.2. That's when we see our capacity at our hospitals be really targeted. But right now we're still at 1, and we'll keep an eye on that. Again, that indicator, as many of them do, lags about 2 weeks. And I think that's it for our data today, Governor. Thank you.
Thank you very much. You know, we really can't say enough about our folks who are at the front line every single day. When the coronavirus began invading our communities, our doctors, our nurses, other medical workers really have, throughout this time, has faced it really head on. They've just done a phenomenal job. We are going to be joined today by Jeff. Before contracting COVID-19, Jeff, who's a physician in Southwest Ohio, was healthy, active, and strong. Now, as he continues to recover, thank God, after more than a month in the hospital, he says he anticipates that he won't be back to normal for a while, and he'll have the opportunity to talk with him. We've asked Jeff, and we've asked his wife, Tina, who's also a physician and also contracted COVID-19, to tell you their story. The story reminds us, all of us, about why taking safety precautions for ourselves and for others is so very, very important. So thank you both for joining us. Good to see both of you. We're very, very grateful. Jeff, I wonder if we could maybe start off with you, and you could talk a little bit maybe about your experience.
Sure. Thank you, Governor DeWine, for having us both. Like you said, I was a pretty healthy person for 63. I ran in the woods with my dog. I exercised. We live on a 60-acre farm, so there's a lot of physical labor to be done. And March 20th, about, I started just to feel fatigued and maybe low-grade temperature, nothing much. That was a Friday, I believe. And knowing the COVID pandemic was at hand, I went to a urgent care because at that time, that was the only place that would test, and I didn't want to expose my patients. And I ultimately ended up testing positive, but my oxygenation was good. I did not really meet any of the criteria for admission. And then I think I was admitted on the March 27th, but that day, and I was laying down, having fever, chills, fatigue. I did not have much of a cough. I never was short of breath, but I think I was not always lucid. And my wife, at that point, decided she was going to take me to the hospital. And that was the beginning of that. And I went to the hospital, Bethesda North, and pretty quickly, the doctor told me that I was going to need to be intubated. And I went pretty much to the ICU. And for those 4 days, you know, it's all a blur for me because I was under heavy sedation and intubated. And my wife probably at that point was a mess because when you're dropped off at the hospital, usually you go into the hospital with your sick loved one, but they says, go wait in the parking lot and we'll get back with you. So that is one of the big problems with COVID-19. Nobody that you love can really be in there and touch you and help you, and with both the emotional and the physical, you know, disabilities that you're experiencing. So that's how it started. Tina could talk about how it was to be put into the parking lot.
Well, the first 48 hours, I did not stay in the parking lot for 48 hours. I'll say that. I felt like I wanted to, but I had some of my adult children at home that I needed to console. So the first weekend was very rough. Jeff, his heart was affected by the virus. His cardiac enzymes were way up. He was on the ventilator. Liver and kidney functions were abnormal. And a lot of his markers that show that he was in something called cytokine release syndrome were elevated, including some of his clotting factors. And his blood pressure started to drop, and he had to be put on 2 medications to keep his blood pressure up. So it was a really long weekend. They decided that he was in something called cytokine release or cytokine storm and treated that. And pretty quickly after that treatment, things started to turn around. And within the first 4 days, he was off the ventilator and his laboratory abnormalities were improving. And he was doing quite a bit better at that point. But that was the beginning of his month in the hospital.
Wow. Yeah.
Yeah. So when they take you off the ventilator, Governor DeWine, they put you on these external ventilators. So when people complain about the discomfort of wearing a mask, I hope they never experience these external ventilators. The one is like an astronaut helmet, but it's plastic, and the pressure changes in and out so that you could breathe. It's extremely loud. The steam builds up in your face. I'm not a terribly anxious person, but it created a lot of anxiety. The other one's called a BiPAP that sort of sticks on your face and again exchanges air. Neither of them are very comfortable. Both of them were life-saving, but they were very much anxiety-provoking, and it was tough at those points. And of course, I had no one there with me, so.
How long were you on that second one? That
was off and on because I relapsed and went into another cytokine storm several days after the first one. So I was on those for several days.
He was on about 2 weeks, and then he had his third week in the hospital. Everything started to look kind of dark again. His blood pressure started dropping. His temp went back to 103, 102 for most of a week. They were considering that he might have a secondary infection, which is especially worrisome with COVID patients. But when the labs came back, eventually, it looked like he had gone into at least the beginning of cytokine release again, required more treatment for that. All this time, he'd been using the BiPAP mask or the BiPAP hood, and he really did have a lot of period of confusion in there, and just so difficult to be away from him and not be able to be there to help comfort him and console him when he was going through all this. But once the second worsening happened, then he spent another about 10 days in the hospital, just gradually improving, and still continues to make some progress here at home.
Dr. Atkins here. I'm going to ask her if she has any questions.
Good afternoon. It's an honor, first of all, to meet you both. And I really, I'm so sorry you've had to go through this. I think one of the hardest things as a physician that I've been facing is we talk a lot about people dying from this. And people don't talk about the thing we talk about in medicine called morbidity, meaning how hard it is to have it and recover. And this started, your journey started March 20th. Here we are in May. I can tell that Jeff, you're still having trouble breathing and talking right now, right?
Yeah. It's so much better, Dr. Atkins, than it was. The first time I stood up, I think they wanted to weigh me, which I went from 220 to 170 during that hospitalization. Yeah. And I'm about 6'2". So most of that was muscle mass. So I'm thinner, a lot thinner. I always want to lose a little bit, but not this much. But the first time I stood up, I said, what in the world is going on? I felt like I was on an alien atmosphere of poisonous gases. I could not even breathe or take a few steps. I was literally gasping for air. And that's sort of the biggest thing now residually is my lungs and the pneumonia and the subsequent damage that it's done. But it's getting better on a weekly basis. It's a slow process. I still have some conversational dyspnea, but I feel better. I could walk, from one room to another. I have to raise my oxygen up, but it's better, and I'm thankful and for that.
As physicians, what would you like to tell people? Now, you've lived it as family, you've lived it as patient. We know people are out there, we're mixing more, but what advice would you have to us? And what more could we be doing?
Yes. That first, and Tina could follow through. But correct me if I'm wrong, there is really no FDA medication that's approved for this.
That's
We're
right.
still researching it, promising drugs. But there are the lifestyle things that we can do. Good hand washing, social distancing, wearing a mask when you're out there. The mask isn't 100%, but we want to protect those who are most vulnerable. And I think people have this cavalier thing that, you know, I'm young, need to worry, but, you know, as stated before, the range of deaths is from infancy to over 100. So any of us are susceptible. And I'm not on any medications, no blood pressure issues. I felt I was in very good shape. So it's, you know what, it terrifies me, but I understand we have to open up and get businesses opened and restaurants. It's a scary thing for me because I went through a traumatic event, but I would hope that people would do whatever is recommended to prevent furthering this pandemic.
Thank you.
Well, thank you, Jeff, Tina, both doctors. Doctor, thank you. We appreciate it and very, very much.
Thank you.
And you're very kind.
You
You're
do.
very kind to share this with us, and we wish you all the best. But we felt it was
Appreciate it.
important
Thank you.
for people to see and hear really from someone who'd experienced this, and I guess both of you experienced it, different way, but to hear directly from you, and so thank you.
Can I say one more thing?
Sure, absolutely.
I had overwhelming support from my community and people I didn't know. And I want to thank them, family, friends, and strangers. I was getting 50 to 100 cards a day in the
Wow.
hospital that I could not go through because I didn't have the physical strength to open them up. But I would try to include it as part of my physical therapy here. And then just the prayers. So, you know, some good came out of this. It shows me how important family and friends are. And I
great.
just wanted to thank all those people.
That's great. Thank you both very, very much.
Thank you so
We're
much.
very grateful.
Thank you.
We are ready for questions. Hey, Laura, you're.
Good afternoon, Governor. It's Laura Bischoff, Dayton Daily News. We're nearly 3 months into this crisis, and 3/4 of the deaths are linked to nursing homes. Why didn't we have more comprehensive testing earlier in the crisis, now that we have the benefit of 2020 hindsight?
There certainly is, Laura, has been some testing. You know, when a nursing home knew that they had someone who might be positive, you know, testing was done. But this is the first time we felt really we've been able to deploy with this much of focus because of the testing. And it's not only the testing that we're seeing done now, but as we've talked about this, our capacity is going up. And so we're going to continue to push that capacity up. And, you know, as the guard goes out, our testing is going to have to continue that capacity to go up. So we're in a position now to do it. And I think, you know, when I looked at this, and we kept looking at the numbers and said, okay, you know, where are we going to deploy this testing? You try to do two things at once. One is you're trying to keep from there being community spread, and so that's why we're increasing the local health workers who will go out and interview people in the community who have already tested positive. That's why we have to do community testing. But to save the most lives, you clearly have to go and focus on where people are dying. And they're dying in our nursing homes. They're dying in our other congregate care facilities. And the other thing that we have done is that facilities that the state runs, we talked about yesterday, the 2 nursing homes where our veterans are. You know, we've gone in with very significant testing in those. We announced today about people with developmental disabilities who are in state facilities, and we are carrying out testing there this week. I don't know, Dr. Acton, you want to add anything to that? It's because I think Laura's question is a very good question.
Yeah.
Anything?
No, I
Okay.
thought you covered it. Thank
Okay.
you.
Okay.
Hey, Governor. Andrew Welsh-Huggins with the Associated Press. Governor, you said on Meet the Press Sunday that mask-wearing compliance in a lot of Ohio stores is 90%, but you want that to continue to go up. Even casual observation across the state would indicate the percentage is much closer to 50% in a lot of places, if that. What confidence do you have that after weeks of recommendations, we could get anywhere near 90%, let alone surpass it?
Well, I think anybody who just listened, for example, to Jeff, that's a pretty compelling story. And I think the thing that we sometimes miss, as Dr. Acton says, is that not only do people die from this, but people get horribly sick from this. And I think as that reality sinks in, I think more and more people will wear a mask. Now, we have mandated it, as you know, for every employee, unless there's some reason they can't wear a mask, but virtually every employee. As far as people going in to stores, I agree. It certainly varies, and it varies by community. I talk to people and ask them, when you're going out, how many people did you see, what percentage? So you're right. We're certainly not at 90% today. And if I said that, I misspoke. We are not at 90% today. But that's aspirational, I think, is an aspirational goal. And I think that, again, this is not about politics. This is not about liberal or conservative. This is not a liberal or conservative issue. This is a issue of how do I protect my neighbor? How do I protect people that I love? How do I protect people that I don't even know? And so we just need to get this beyond that this is some sort of political issue. It's not at all. It's about protecting each other. It's as, it's as old as the scriptures, love your neighbor. I don't know any other way to express it. And is it perfect? No, it's not perfect. We know that, but it's another layer. And the evidence is clear. It is another layer. And so if you have the option to use another layer, why don't we just use it? And again, I think more and more Ohioans are going to continue to do this. And so I'm an optimist, and I'm confident. And look, I was at a funeral, Sheriff Radcliffe's funeral. Everybody who was there at the funeral, and they were doing the social distancing, they were doing everything they should have been doing, and every officer was wearing one of these. And that was, certainly a request by the Radcliffe family. So it's that type thing that we can do. And I think as we get used to it and look at it as a small thing that we can do that doesn't take a lot of effort, I think you're going to see more and more people who are going to do this.
Thank you.
Good afternoon, Governor. Jeff Reddick from ABC6, Fox 28 in Columbus. Going forward, as the economy continues to reopen and businesses continue to go back to work, how can Ohio compel workers themselves, employees, to go back to work? The reason I ask being that the Department of Job and Family Services has removed a link to report COVID-19 fraud. At the same time, the federal government is looking at a back-to-work bonus to try and financially compel people to come back to work. Does Ohio have any way to try and further compel, if not force people to come back to work? Your Director of Job and Family Services, I believe, has said
we don't intend to compel people to go back to work. People are going to have to make those judgments themselves. I mean, what we have, the state does have a law, but in regard to unemployment compensation, but we're not twisting anybody's arm to go back to work. I mean, I think it comes down to what it's always come down to, and that is, do people, the employees, feel safe going to work? And I believe that Ohio is at the forefront in this. We're not the only state that's done it, but I think we've done a very, very good job in every single industry, every single profession, coming up with best practices. And so that that worker knows that the best practices are going to be used in their job. That best practice is put together by people who understand health, as well as people who understand that particular profession or that particular job. So that's something that we have done that we think will encourage people to feel more confident about going to work, but that is ultimately an individual decision that individual has to make.
Would your office consider any financial motivator, somewhat like what the government and Senator Rob Portman are looking at? A back-to-work bonus, per se?
Well, I'm not sure exactly what Senator Portman's looking at, so I don't know how to answer that question. If you're looking at the state having any money to do that, there's simply no money to do that. If that was an economic incentive, there's just no money. We have no money to do that. We are, we've made cuts, significant cuts, as we should have, about $760 million for a 2-month period of time. We have seen the economy go down, tax revenues obviously go down, at the same time social service costs go up. So I don't see any money available to do that.
Thank you.
Hey, Governor. Jim Oddie from WHIO-TV. Thanks for doing this today. I wanted to ask what else is in the pipeline. We have daycare centers, many of them coming back, many other businesses coming back starting today. They have the ability. Daycare centers a week from today. What else is in the pipeline? We have many people asking us about things like casinos and racinos, which are a big part of our economy in the Miami Valley. How close are we on that? And then, Governor Acton, are you satisfied? Are you comfortable with this rate of return?
No, I'm not comfortable. I don't think anybody in my position could be comfortable. We're going to watch these numbers. We tried to do the opening spread over a little period of time, a matter of a few weeks, not do everything the same day, and to try to see exactly what results we have. I think it's expected that we'll see our rate of infection go up. One of the things that you will see, because we're going to be, testing is going to continue to go up, you're going to see as more people are tested, you're going to continue to see more people who will test positive. But in addition to just that, I think you also probably will see more people as we open up this economy, people are out more, I think you're going to see more people test positive. So comfort is not where I am. We are at a crucial period of time. We have to open the economy. It was the right thing to do, but we got to be very, very careful. And as Jeff pointed out and his wife Tina pointed out, 2 doctors, getting this for some people is just must be god awful. Just to hear them describe that. So this is not anything that's that we take lightly. We got to be very serious about this and continue to do that. So, thanks.
Thank you, Governor. Thank you.
Kevin Landers, WBNS 10 TV. My question is for Dr. Acton. We're getting emails from viewers who have patients in the hospital with COVID-19, and as we just heard from the 2 doctors, currently families are being denied the chance to see their loved ones in person as they argue that patients have a right to have a patient advocate with them during their care. Can you address this concern, and should hospitals begin requiring or at least allowing a patient advocate to be at the bedside of these people who are in the hospital from COVID-19?
Thank you. I didn't know, Governor, if you had thoughts, but
No, I'm going to let Dr. Acton answer it. The only thing I would say is this is decisions made by the hospitals. This is not an order, but I know you didn't say that, but I just want to make that clear. That's not anything that our health department or I have ordered, but I also know these are gut-wrenching decisions. And you know, just from talking to people who've been in the hospital or people who have someone in the hospital, I know this is horrible, not to be able to, you know, be there with your loved one, or if you're the one in the hospital, not to have your loved one there or your loved ones there, must be just absolutely horrible. I can hardly imagine it.
Thank you, Governor. I would just add, Kevin, I feel the same way. As you know, recently my daughter was hospitalized, and we went through this very same experience, not for COVID, for something else. And it is a decision. This wasn't part of an order. It is a decision. It was a decision made by hospitals. I believe they, from what I've heard, are looking at their policies very carefully. I've had conversations with the zone leads that I have contact with, who then in turn work with the Ohio Hospital Association and each other. And so I know this is a policy discussion. I do think being able to have advocates has always been a very important thing in healthcare. So I would strongly urge our counterparts to come up with policies where they think they could at least help with that. And I know, as you do know, in nursing homes, it's been a much higher risk situation, and nursing homes are following policies and trying to deal with that. And that's another policy that our team is looking at, trying to find the best ways. We've been doing technology. We've been trying to do all we can while stopping the spread of the disease. But this has been, I think the governor and I would both say, one of the hardest and most gut-wrenching parts of this pandemic. So I guess I would refer you back, and the hospitals might like to speak on behalf of their policies.
Thank you.
Ron Hammy with WLIO in Lima. Either Governor or Dr. Acton, I first didn't get to see the graph. If we hit that target of 22,000 tests a day, and then going off the last question, with nursing homes, is there a target date you expect to allow people back in to see their loved ones, or should they expect to wait for a vaccine?
We have a group, not just of our people, but people outside the governor's office and outside the health department who are looking at that last question. I think virtually every state prohibited visitors to go into the nursing homes. That was one of the first orders that most states made. It's an order that makes sense when you think that COVID-19 has to, if it comes into the nursing home, it has to come in from somebody from the outside. But we also know how difficult that is. And now we're, you know, a number of months, several months into this. And so we've got family members who have not been able to see other family members for an extended period of time. So I think it's a very, very difficult issue, but we are actually looking at that issue. And the other issue, I'm sorry.
Had you reached 22,000 tests a day yet?
What was the first part?
If you guys have reached 22,000 tests a day yet?
No, we chart every day how many tests we have. We've been running between 8,000 and close to 10,000. Those numbers need to go up, and we are dedicated to getting that done. I think you're going to see them go up when we start, certainly when we start with the National Guard testing this week. You're going to see those numbers go up. The other thing that we're seeing out there is you have more companies, Walmart, for example, in the private sector that are expanding their private testing. And that's going to be, again, available to more and more people, and that's going to drive the numbers up as well. But we're not satisfied at all with where we are. We're testing more than we were. We now have the capability, and we have the confidence that we can continue to move that up. I mean, we couldn't have deployed the Guard as we are this week unless we had some confidence that we will be able to continue to drive these numbers up.
Thank you.
Good afternoon, Jackie Borchert from the Cincinnati Enquirer. Following up on his question, in the last week, we've tested on average 8,500 a day, and we've been around 9,000 for the last 3 weeks. So why haven't we gotten closer to that 22,000 a day number? Is it an infrastructure issue? Are people not seeking testing? If you go to Kentucky's website, for example, the front page of their coronavirus site shows a map of where you can go and get tested.
I'll start, and then I'll let Dr. Acton jump in. Look, this is obviously frustrating. This is a question I ask every day to our team. They spent all weekend continuing to work on this. We got a breakthrough. We had a breakthrough when we were able to sign the contract a few weeks ago in regard to brand new reagent and new machines. That allowed us to say, look, here's where we think our capacity is. It was 18,000 moving to 22,000. We projected that capacity out. But that did not solve the swab problem, did not solve the distribution problem. If you look at our hospitals, some of our hospitals are now who do the testing, some of this testing, they are having reagent problems as well. So it is a complicated issue, but we're working on it every single day. Dr. Acton?
Yeah, Governor, I would just add, I think where the numbers come from that were mentioned were a capacity issue. And the capacity came from the actual machines and the one type of the reagent, not all reagents, but one type that could be run on this particular machine. And in fact, that product has been delivered, we have the machines, and we have that reagent. But that's a capacity of a machine. That's a factory listed what you can do. What I've come to understand, and there's a whole team that's doing this, so I don't want to speak on their behalf. These are the same questions I ask of the team governor as you do. But having that capacity, but actually having the labor force to run 3 shifts, the people to go out and get the testing, all the other types of equipment and reagents that are part of it, because there are different chemicals that you lose along the way. The fact that there are people who aren't always getting that testing, it's a complicated whole system. And so you can't solve for just that one piece. The 22,000 was the capacity of one kind of machine, high throughput, but the actual system of all the components has many missing pieces and many parts that have need streamlined. Even things as simple as the types of forms you use and the barcoding. So there's a complex system of testing, all of which are being addressed, and this team is putting forward a holistic testing plan to the governor, and they'll also, Governor, be reporting that to the Department of Health and Human Services. So I think we're close to seeing that comprehensive plan the governor has actually asked for.
And the only thing I would add to what Dr. Acton said is that it never was a system. I mean, we can talk about a system. We're building a system as we are doing testing and trying to save lives. We're doing it literally at the same time, and there's never been a system, and so part of it is things like going to a 3rd shift at the hospital labs and other things such as that. So I think you're going to see numbers get better and get higher, but we are certainly not satisfied with where we are.
Good afternoon, Lucia Lynches for IN Ohio. Just a quick question. We've had some readers reach out to us and say that they've had their unemployment and it's been approved, but they've gotten a letter saying that they need to get that money back. Do you have any idea how many, just in terms of numbers or percentage of people who have had their unemployment clawed back? And is there anything that they can do if they can't get through on the unemployment hotline to try to dispute that?
I'll find out. Do you know why they were clawed back? Or are they telling you why that it was clawed back from the state?
It was approved, and then they appealed it, and then it was clawed back later. So I'm not quite sure, and there's a few different ones, so there's different reasons there, but.
We could have a specific example. We can run that down, and maybe if you can give us that or give us some information, and we'll try to have an answer for you on Thursday.
Great, thank you so much.
So.
Hi, Governor. Andy Chow with Ohio Public Radio and Television State House News Bureau. I wanted to get to the nursing home strategy. Can you talk a little bit more about the strategy going into what those teams will do? How will they identify which nursing homes have that contact with COVID-19? And why test just the staff to begin with?
Well, the staff are obviously the individuals who are coming into the nursing home, and they're the ones who, you can't get into the nursing home unless someone brings it in. The logical place where it comes in is staff, because we try to seal off basically everything else. And so testing staff makes sense from that point of view. To kind of go back, they're trying to prioritize where they start. They have prioritized where they're starting. Again, they're starting with the nursing homes that have had COVID. We know they've had COVID in the past. And there's other factors in there that they're deciding where to go. The goal is to test all the nursing homes, test them as quickly as we can, to test all the staff, all the shifts of the staff. But at the same time, if there's a reason, if there is COVID found in there, then it is the traditional tracing of, okay, let's see who that person would have come in contact with. And so you try to surround that person and find out, who might have been in contact with the individual who you know is positive. And so you go out and test from there. These are clinicians that are going to make this decision. And so in some nursing homes, conceivably, you could be testing everyone. In other nursing homes, it could be a wing. In other nursing homes, it could be another area. But again, those are data-driven decisions and decisions based upon best medical practice. That's how those decisions will be. What I've simply said is, look, it's time. Look, it's what we need to do. The only direction I've given is go save lives and come up with the best way to deploy these resources to go do it, and let's move. No.
Governor, if I could add just very quickly. Yep. Andy, this is going to be a really holistic approach. We've been testing in nursing homes themselves. They've been doing testing all along. We've been doing strike teams that come along with local health departments and the state health department to help nursing homes do the best practices alongside the CDC. What this is going to be is a show of goodwill and support to our nursing homes. Please know that a nursing home having a case does not necessarily mean that someone's doing something wrong. This is a terrible disease. It's very infectious in congregate settings. This is a show of support by the state to come alongside. We're going to be doing best infection control practices. Clinicians, hospitals, and local health departments are pairing up with nursing homes to help them make sure that they have all the best tools at their disposal to manage this. We know it's a long haul. We know this is the highest risk group. 63% of our deaths have occurred in this group. So what we're trying to do here, again, is something that's never been done before, but is a best attempt to give them everything we can. Thank you.
Andy, thank you very much. To close, you all have heard us talk about Eric, who's right there behind the camera. Eric Porter is an integral part of our press conferences, and we certainly could not do this without him. He's a graduate of Ohio Northern University, which is where I went to law school. He's been working with us for many, many years, worked with me when I was in the Attorney General's office, and continued to work since I've been governor. He is a very talented photographer, videographer, and today we want to show a video that Eric recently made, and he made it for the bluegrass band Joe Mullins and the Radio Ramblers. Fran and I are big fans of the Radio Ramblers, big bluegrass fans. They are a great band. They have a national following. They perform many times at the Grand Ole Opry. And they also were awarded the Entertainers of the Year award at the 30th Annual International Bluegrass Music Awards Festival. So a couple years ago, Fran asked Joe Mullins, who's part of this group, who leads this group, who's actually a neighbor of ours. She said, you know, how about coming up with a great song for Ohio? And so Joe found this song, and you're going to see it performed by the Radio Ramblers, and the video is by Eric. I think it's a great tribute to our wonderful state of Ohio.
Traveled round from state to state to other lands I've been. There's no place in this whole world like the Buckeye State, my friend, where peaceful farmland stretches out as far as the eye can see. From the hills in the south to the lake up north, it's home sweet home to me. Ohio, I'm heading home to you. The road to Columbus will carry me through the sweetest country in the land. That's where I long to go, 'cause there's nowhere that can compare with Ohio. Mighty fine, the home of Bill Monroe. And West Virginia's wonderful and wild, I know you know. And lots of folks, they'd love to live in sunny Tennessee. But put me in Ohio, boys, that's where I'd rather be. Ohio, I'm heading home to you. The road to Columbus will carry me through the sweetest country in the land. That's where I long to go, 'cause there's nowhere that can compare with Ohio. Still wondering why Ohio's where I'd rather be. My wife and children live there, and they mean the world to me. Mom and Dad still live there too, they say they miss me so. And the kindest friends that's ever been all live in Ohio. Ohio, I'm heading home to you. The road to Columbus will carry me through the sweetest country in the land. That's where I long to go, 'cause there's nowhere that can compare with Ohio. For nowhere can compare with Ohio.
All right, we will see you all on Thursday at 2 o'clock. Thank you.